We presented at ASH 2019 in Orlando the first preliminary results from our phase 2 single-arm study using Daratumumab with Carfilzomib, Lenalidomide, Dexamethasone, referred to as Dara-KRd. This is for newly diagnosed patients, and we presented at ASH around 80% MRD negativity as a best response after up to 8 cycles. And this was captured before any patient had gone forward to any transplantation or melphalan chemotherapy. So 80% MRD negativity just with this new combination, Daratumumab-KRd. The study, because it did not mandate transplant, was open for patients with myeloma at any age, as long as they were eligible for enrollment. In the overall study, the oldest patient was 80 or 81 years old. So for patients who are fit, you have a fantastic regimen that can achieve very deep responses. These results were based initially on a twice-a-week dosing schedule with Carfilzomib, but the study then expanded into a once-a-week dosing schedule, which was part of the main analysis. The paper is not yet out in print, so everything I tell you comes from the ASH presentation of 2019. I do think that this is very important in the setting of the COVID-19 situation. I think it really addresses the fact that you can achieve fantastic responses that are deep and probably very durable with these new drugs in the absence of a transplantation. I think exposing patients to melphalan chemotherapy and causing very profound and sustained immunodeficiency for many months, 3, 6, up to 12 months, patients have to be revaccinated for all their prior vaccination programs after transplant. I think it really raises the question, is this really how we want to treat our patients with myeloma going forward in the COVID era? I think we now have new drugs. We have debated for a long time whether transplant is needed or not. But I think the new question is, do we really want to expose our patients to such a harsh medicine, such as melphalan, that could put patients at risk for severe immunosuppression in the era of COVID-19. So these are questions that I don't have all the answers to, but I think they are very appropriate to address.